Doctors in the Midwest are warning that risks to patient safety at University Hospital Limerick remain intolerable and unacceptable unless urgent action is taken to expand acute hospital capacity across the region. In an unprecedented statement, the HSE Mid-West Medical Board called on the government to immediately establish a development board for the proposed new hospital, release emergency funding and lift staffing restrictions. And joining us on the line are Professor Joe Devlin, the consultant physician and deputy chair of the medical board, and Associate Professor Alan Watts, who's consultant in emergency medicine and a board committee member. And thanks to both of you for joining us. Joe, why did you feel it was necessary to directly warn the Minister for Health in such stark terms?
Well, I think it's a journey we've travelled over quite a while, and your listeners will be well aware of the investigations that have been done, most recently the HICWA one, which clearly identified the lack of beds we have in the Midwest, with the fewest Model 4 beds. They're the beds you can go to with major illness, the ones we have in Duradoyle and Limerick, and a higher proportion of beds that are described as Model 2, and your listeners might more understand them as step-down beds, which are the type of beds we have in Ennis and in Nenagh and St. John's. And until we have our new beds built at the site that's been identified by the Minister and purchased by the HSE, until we have those on stream, we're still facing overcrowding. And overcrowding is well established as contributing to delay and to medical error. So that's why we want to identify the risk. But the problem we're facing now is that although we have a site, we still don't have a hospital development board. And that board is the group that's going to plan for how we get planning permission, we start construction, and we phase the movement of services between our sites. Now, the Minister was talking yesterday about the use of the regional facilities, and we're the national experts in using the regional facilities. And she referred to Limerick consultants. We actually don't have that many pure Limerick consultants. You'll probably be aware that there are services in all sorts of medical and surgical specialties happening in Ennis and Nenagh and St. John, mostly delivered by consultants who work across all sites, myself included. I do 2 clinics a week in Nenagh. So we're all for using our regional facilities to the maximum effect, and the plan is on the Minister's desk, which involves expanding that use. But to do so, we need staff, and the current plan involves recruiting some 200 or 300 staff to increase the number of specialties that work in the regional sites and the times that they're open.
And Alan, there is the call for emergency funding and the lifting of staffing restrictions. I mean, how much are recruitment ceilings affecting patient safety at the moment? And I suppose tied in with that is the staff that are there, the frontline staff. I guess are after years of sustained pressure, or no doubt have reached, maybe gone beyond burnout levels.
I suppose especially from a nursing perspective, we have sustained consistent deficits in the emergency department from an emergency nursing and healthcare assistant point of view. Our numbers of non-consultant hospital doctors and consultants have increased in the last 3 to 4 years, but we do have those sustained vacancies in nursing, which is a major concern. As we've outlined in our statement, we're really calling on a suspension of any staff ceilings and for emergency funding to be released in order to escalate those campaigns to recruit new nursing and other staff that are so vital to the delivery of these services, not just here on the Duradoyle site, but across the Midwest.
Joe, we know a new hospital for the Midwest was announced, yet you believe there's been little meaningful progress since. What specifically is holding things up in your view?
Well, I think the Minister stated yesterday she wanted a comprehensive plan for use of the regional sites in Ennis, Nenagh and St. John's, and that's why I was emphasising with you how much we use those already. 30% of our beds in the Midwest are in Nenagh and Ennis, St. John's and Crewe Orthopaedic Hospital. So we're very interested in using those to maximum effect. I personally don't see the necessity to stall planning for the acute beds on the new site. I think the two processes need to happen in parallel, and we're all for developing the smaller hospitals using staff that are mobile, so that we have specialty input in both the centre and in the smaller hospitals, as is currently happening. But to expand it further, we need more staff. But the real urgency and the real risk and the major issue for patients, whether you live in North Tipperary or Northern Clare, the biggest risk to us is that there aren't enough acute beds for when you're seriously ill. And that's why we really need to get on with having this board in place and developing the new site.
Alan, do you believe there's been a lack of urgency from both government and senior HSE leadership on all of this?
I think the report by HICWA last September certainly demonstrated what we as consultants in the Midwest have been saying for a number of years, and have been supported by other organizations, that the fundamental issue has always been a shortage of beds. So the fact that HICWA identified the fact that this was the main problem in the Midwest was certainly a move in the right direction. And the fact that the minister herself in mid-December highlighted that there would be a blend of the three options that were recommended by HICWA as to respond to the urgent and emergency care in the Midwest was also encouraging. I suppose the fact that now that report from HICWA is more than 7 months old, the minister's comments about which options would be undertaken, and it was a blend of all three, and then the acquisition of the Raheen site announcement back in March demonstrates how slowly these processes occur. And so, yes, we're still in a crisis mode. This morning, we have 32 patients awaiting beds. So 32 patients on trolleys in the emergency department awaiting to go to a hospital bed, with other patients on trolleys on the wards. And corridor care really is not acceptable health care with the associated risks that come with that. So the minister herself yesterday, when she met with the Friends of Ennis Hospital Group, said that these processes can occur in parallel. The development of the new hospital, which essentially is option B, and the expansion of services on the Doradole site, which is option A, in conjunction with expanding the services available in Ennis, Neenah, and Johns. These can happen in tandem, and I suppose that's what the medical board is calling for.
Okay, so look, you're both calling for urgent action and the immediate setting up of a fully empowered development board. Just finally, Joe, you've said healthcare decisions must never be shaped by political pressure or convenience. In terms of the delays and slowness of the whole process, do you believe politics has played a big part in that it has delayed necessary action in the Midwest?
Well, look, we especially as we look at world events in certain countries, we must always remember what a privilege it is to live in a democracy and how highly we value that. So we elect a government, and the government chooses its cabinet and goes to work. And it's of course appropriate that public representatives take an interest in things that affect the lives of their constituents. But I think there does come a time where you've had experts such as the group that HICWA set up to perform the investigation of what's needed. There comes a time then to engage professionals and to implement the findings. And just to amplify Alan's point, bricks and mortar take time. We all accept that. But what is harder to accept is that we're not going as fast as we possibly can, accepting that it does take a little time. But in the meantime, using our existing structures, both centrally and in the other smaller hospitals, needs more staff. We're currently really, pedal to the metal in terms of what our staff can deliver. And the plan on the minister's deck, I think she noticed that there was a CT scanner, for example, that wasn't operating in Ennis when she was there yesterday. And that's simply because we don't have enough radiologists, radiographers, clerical officers to man it all the time. So if we can implement the plan on her desk, which involves recruiting 200 to 300 additional staff to open these facilities for longer and for a wider spectrum of work, then that can address some of the risk you've mentioned. But without the additional staff, we simply can't do that. So the urgent need to help with risk is to raise the employment ceiling and to get rid of the revenue barriers we have in the Midwest until such time as we reach parity with our sister regions around the country, because that's our issue. We're not being treated fairly in the Midwest.
Okay, we do have to leave there. My thanks to Professor Joe Devlin and Associate Professor Alan Watts.